Hi, this is Meg, Julia, Julie, and Danny. We're doing the Put It All Together case study for OB. So let's kick it off with Miss Maria here. So what are some specific screenings that may be employed with Maria?
Yeah, I think it's important to do a depression screening. In our based off our research, the Edinburgh postnatal depression scale might be best. We also want to assess and screen for intimate partner violence.
Yeah.
Thank you, and domestic violence. We also want to just screen any coping mechanisms that have been successful to her in the past and how she deals with life stress, because she's got a lot going on right now.
Yeah. She sure does.
We should also probably do some prenatal screening because she hasn't had really any prenatal care.
Yep,
And
that's a
talk
good point.
about like her like folate or whatever. So
yeah, make sure
screening
she's
those. Yeah, making
Yeah.
sure her lab values and everything are good.
Lab values, blood pressure,
Yeah,
cool.
would be important.
All right. So with Miss Maria, what patient problems are immediately identifiable in this situation?
Yeah. Sure. Okay. I'll. Here I go again.
Or I can go.
Yeah, it's all right. It's mostly just the same stuff.
Okay,
you know?
yeah. So we're concerned about, hypertension, preeclampsia, possible kidney infection, domestic violence. It seems like she has a controlling partner who wants to control her meds and just is by her all the
She
time.
hasn't been able to, be alone or be
Mhm.
able to answer things.
Yeah, she has no family support,
Right.
Yeah.
so she's kind
And
of
it
all
seems
alone.
like her partner has convinced her that no medication is safe to take during pregnancy.
Yeah, which isn't true.
Right.
we need
So
to
I think that we can
reevaluate.
do some education on which medications are okay and the risk and benefit that would provide to her. So that would be a conversation we could have with Maria.
Yeah, also just again with the depression and other mental illness, like with the blood pressure medication, she also stopped taking her her anxiety or depression medication. So that's just, she's at higher risk for having some imbalances there just by, abruptly stopping the medication, and then also just with the hormones of pregnancy and all of the stressors that are happening, it's important that we address that.
She could have higher risk for postpartum depression, postpartum psychosis.
Yeah.
Exactly.
So with all that being said, how would we prioritize addressing these problems and why?
Yeah, safety's first always. So trying to get her alone to answer some questions, trying to get her to be able to speak for herself, and maybe getting the partner away from her. Recognizing and assessing the safety at home, and just making sure she has a safe place to go if anything were to happen, or if she did decide to leave the relationship. Making sure she has a safe place to go, and then just giving her extra resources for victims of domestic violence, pregnancy, prenatal care, pretty much everything. We just want to make sure that she's safe and is being properly seen and treated for everything. And then in terms of medically, we want to address her hypertension and her depression, like Meg was saying earlier, educate her on those medications and which ones are safe to take during pregnancy, if we do need to alter them, or if we don't, how to, get started taking those again. We would want to treat her for a kidney infection after all of those screenings, and then as well screen for preeclampsia, and then assess can you help me with that word?
Oligohydramnios.
Oligohydramnios. Yeah. Just make sure that isn't causing anything harmful for the baby or the mom, and just kind of getting a good finger on that.
Yeah.
Well, and you could get her like on WIC and EBT and stuff since she's not employed, and making sure she gets like all the nutrients and
and prenatal care too.
Yeah,
Mm-hmm.
and they can help with that, the prenatal supplements and even checkups and stuff, blood pressure checkups and things like that at the clinics.
Right.
Yep, definitely need to assess that blood pressure.
Mm-hmm.
So with Maria, how might these problems impact the duration of the pregnancy?
Yeah.
So with the oligohydramnios, we have to monitor the mother and the baby closely throughout the pregnancy. There's a high risk for prenatal mortality, and we need to educate her that if she goes into labor, she needs to come in right away.
Immediately.
Yep. So
Just so we can assess and be able to kind of monitor.
And preeclampsia can lead to preterm birth.
Mm-hmm.
So.
And there's complications in that. They could have eclampsia with that is seizures, the high blood pressure. And if you can't get it under control, then doing a quick delivery, C-section.
Yep.
So if you can't get it under control, and watching the distress in the baby and stuff.
So what are some potential concerns for fetal impact?
Yeah, mostly just a lot of the same stuff. The ogliohydramnios has thank you very much. Decreased placental perfusion, so that's why we want to monitor the baby and mom when she goes into labor and throughout her pregnancy. The preeclampsia that, like Julie was saying, can have impacts on the baby or the mom after birth. Postpartum depression, that is definitely a concern for fetal impact. Infanticide is...
What's their earth side? What?
Is it infanticide or infanticide when you kill babies?
Oh, I did not know that word.
Yeah, it's something like that, but you're at risk for that because the mom can't take care of herself or the baby if the postpartum depression gets real bad. So I'm not tripping, I'm not crazy. And then the kidney infection, we just don't want the mom sick while she's pregnant, and we want to make sure that she has enough energy and fluids and nutrients to provide for herself and the baby. So we want to treat that right away.
So with all those impacts, what further assessments are necessary?
So we need to just closely monitor the blood pressure, do assessments for kidney function, depression, the depression screenings. We just want to make sure she's okay after the birth too. Safe home safety, with the intimate partner violence.
For sure.
Yeah, monitor her urine for protein spills and things like that too.
What are 2 care planning goals that might be considered for Maria?
Yeah, so like we were saying, safety is number 1. Having a safe and therapeutic home environment, whether that is at home and her having to find, the balance of it to be safe, or providing her resources for shelters, or, a safe place, a safe house for pregnant women. We just, want that therapeutic environment. And then just since the blood pressure was so high and is of such concern, just making sure that it's within the range of the systolic is less than 140.
Yeah, getting it under control with new meds and making sure the meds are safe for pregnancy.
Right, and then med adherence is appropriate. Yeah, so those are definitely 2 main goals for Maria.
I think that's great. What topics may require immediate education with Maria?
Go ahead.
Sure. So topics to educate with her. So just discuss the intimate partner violence. It can have a huge impact on her and the baby. So trying to get her alone privately to discuss that.
And there is a lot of education with that. There's many aspects to be educated on, but it's important to do it all.
Well, yeah, this and discussing not only the impact on her, but how it can impact the baby, and we'll discuss further, but it could cause fetal death and stillbirth or preterm labor and things like that. So, and then discussing her high blood pressure and how that affects her and how it can affect the baby, and like we just said, it could lead to preeclampsia and things like that, and so how we should get it under control and why it's important too. And then discussing the benefits of prenatal care with her and taking her supplements and why it's important. Also discussing her oligohydramnios and why it's important to come to the hospital when she goes into labor.
Yeah, for sure.
So, lot to discuss.
Yeah,
lots-
absolutely.
She's gonna be overwhelmed.
yeah,
with
there's a lot going on.
information.
So with all that too, what?
I was just gonna say, but
added?
still like providing like a therapeutic, non-judgmental environment.
For sure,
That's
that's
important.
really important.
Because it's hard to get out of those.
It is so
Domestic
hard to get
violence.
And
out of
ultimately,
those
we
They
want
can
her
be
to show
very-
up. And
She grew up in a
take care.
family that she was abused, and now she's
Yeah.
in one, so it could be very embarrassing
It's-
too.
yeah,
Like, how did
absolutely.
I end up here again? You know?
Yeah. Yeah. So just. stuff
And
for
you're
that
at
support.
your most dangerous point when you choose to leave the relationship, you know, and that's a really scary feeling. And
Well, and she could feel really
Everything.
vulnerable. Like,
yeah,
where am I gonna
well,
go?
and she relies
I
on
have
him
no
for financial
one.
support.
I have no money.
Exactly.
Yeah.
Yeah.
Right.
Exactly.
So she feels
There's
stuck.
a lot of moving parts, a lot of
Yeah.
factors.
Mhm.
So we just have to be there to support. I think that's a great point. Non-judgmental, making sure we just offer some support and just someone that she can, you know, trust.
Rely on, yeah.
Yeah,
Mhm.
and have a good relationship with.
So with all those moving parts, who are important professional interdisciplinary team members to coordinate with on care planning for Maria?
So a social worker, you know, to offer those resources, the primary care provider or an OBGYN just to follow her, you know, throughout the rest of the pregnancy and then after the pregnancy. A pharmacist to, you know, kind of go over what meds are, you know, okay during pregnancy. A nutritionist, a therapist, and then you just put a case manager, just to kind of follow her throughout.
Yeah, kind of oversee
Yeah.
everything.
Yeah.
Yeah.
Great.
Good point.
So what are potential social determinants of health or environmental factors that are identifiable in this case study?
So her poor economic status is certainly one. You know, she doesn't have a job. They live in a trailer. They only have one income. She has no family support. She's not close to her family and no one around her. So she's lonely in that aspect. And then she has, you know, dealing with domestic abuse. So she doesn't even have her partner who she can fully trust. So I think she feels pretty isolated.
Yeah.
Lonely.
Yeah. Rough time.
To
So-
say the least.
Given Maria's environment and medical history, what are some possible contributions to her current presentation?
So the history of the hypertension, you know, she has long
high
history
blood
of it.
pressure.
History of depression, you know, the domestic violence, and then she has a history of growing up in an abusive home.
Yeah, I think something worth mentioning too is that stress is a big risk factor and cause of ogliohydramnios. Yeah. Whatever. I don't care anymore. You know what I'm trying to say.
Gliohydramnios.
Yeah,
Sorry.
exactly.
You did great.
All of it.
You're doing good.
But I mean, I don't know if it can be kind of like reversed, but I think if we can manage some of the stress and help her deal with some of the stress, that can hopefully at least decrease some of the risk factors for the baby.
It's a good
Yeah.
one.
Definitely, I mean, stress and like feeling isolated and all of that can make her depression worse too.
Yeah.
Exactly.
So,
And not having any, you know, family or social support or
Mhm.
friend to just.
and that can lead to like postpartum depression as well. So, I mean, part of this is like making sure she's well set up to take care of her baby once it comes too.
Yeah.
So, cool. So what are some evidence-based physical interventions that can be used to develop a plan of care for Maria?
So reporting the intimate partner violence, determining safety needs and helping her find a safe shelter, somewhere safe for her to go, discussing her blood pressure, medications, and making sure she's on one that is safe for her and the baby to take. As far as like the kidney and bladder infection, making sure she's drinking plenty of water, flushing out her system, and making sure she's going to the bathroom routinely to make sure she's emptying her bladder. You know, you're pregnant, so you're having to go potty a lot more often, and just making sure she's doing that,
Yeah.
not holding it or.
Yeah,
That will
she's
help with
already
UTI prevention.
Yeah, she's already at risk for recurrent UTIs.
Well, and she has
so-
a history of it on top of it.
Exactly.
yeah, just going over all those and educating
Wipe
her
front to back, ladies.
that.
Always.
Yep.
Yep.
And pee after sex.
Yep. Consensual.
Yeah, consensual. Hopefully it's consensual. I was actually gonna mention that. Like,
I know.
I would also screen for like possible sexual abuse too.
Yeah.
Just ask the questions.
Yeah.
You know.
Cover your bases.
Better be safe than sorry.
Yeah.
Mhm.
So, what are some evidence-based psychosocial interventions that can be used to develop a plan of care for Maria?
Just to talk with the therapist, develop a plan, to see her frequently. Discuss the postpartum depression signs and symptoms, early intervention.
Yeah, maybe get not back on anxiety med and help
Mm-hmm.
her balance herself out.
Yeah.
Mm-hmm.
Pregnancy is already lots of,
Lots of
Lots of
hormones
hormones.
flowing in there.
Yeah.
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 Cool.
I think that's gonna be huge. And just like the support groups in that community, I mean, there really is a pretty helpful community for some.
Well, and there's plenty of women who have been through this, and it's like I know it, they know how
You're not
she
alone.
feels.
Yeah.
I've been through it. I went through it. I got out. You
Yeah.
can too.
Yeah,
Yeah.
Yeah.
exactly.
So, what are some family-centered interventions that can be employed in this case?
Yeah, family centered isn't really
It's hard because
very
Um,
typical.
Her
That's
family
a-
is just like her and her baby right now.
Yeah.
Because she's isolated.
Yeah.
her partner is, doesn't have her health at the best interest, and family-centered care is based on mother and baby needs, and her needs clearly aren't being met.
And even, I mean, I think it could potentially be a struggle because, maybe the father is forcefully, inserting himself in some of these roles and in some of the decisions. And so kind of finding that balance where, yes, it's family-centered care and we want to, make sure everyone's included in the decisions, but we need to make sure the decision's right for the mom and the baby, and it
Yeah.
is mostly about the mom,
Yeah.
and kind of like reverbalizing that to him if he causes any issues with it. But yeah, that could be a potential issue.
Maybe educating him
And setting some clear roles, okay, this you can do this and you can help with this, but let's let her do this and make this decision.
Yeah. try to find a balance between them.
Mm-hmm.
Mhm.
So, what are 2 ways you can measure outcomes for Maria?
So we can measure her blood pressure and make sure that it is going down with the new medications or staying within the normal ranges of her pregnancy, that it's not increasing more or staying high, or even dropping. If you go on a new blood
Right.
pressure and it's too much, it could give them hypotension. So
Mhm.
we're going the opposite way now.
Yeah.
And then ensuring that they are in a safe environment.
Yeah.
Maybe doing house checks.
Yeah.
What are those called?
Welfare.
Welfare
check.
Welfare
check.
checks.
check,
Making
yeah.
sure that she's in a clean living environment and she's not locked in a room or.
Yeah.
And sometimes that might
Whatever.
even help with the case of trying to get her out of the relationship, if there's some hardcore evidence that's been seen by other people that this is not a safe environment. I don't know, that's a whole legal issue we don't need to
Right.
talk about. But
Yeah.
But, I mean,
it's important to check.
part
Yeah.
of our role as a nurse is to advocate for our
Document.
patients and make sure they're in a safe environment.
Right.
So, if they're not, I mean, it's
Give
like
her
whatever.
give her a card with a phone number on it, like
Yeah.
a helpline or the nurse's number, like.
Yeah.
If
And I mean,
run
she
away-
might not be ready to leave, but
Yeah,
we can
when
give
she
her-
gets
is
ready,
ready.
call this number and we'll help you.
Yeah,
Exactly.
we can give her resources that she can use if she does feel ready, and we can
Yeah.
reassure her that, if you leave, there's no reason that anyone should take your baby away because you're making the best decision for yourself and your safety and your baby's safety.
But
So
Yeah.
if there's some worry on her part that her
Mhm.
baby's gonna get taken away because she.
Or he might try to get custody or something.
Right.
Yeah.
Yeah.
For
Or
sure.
he finds her,
Yeah.
Sometimes People are
Again,
really
most
crazy and
dangerous
they'll kill
time.
you.
Yeah.
if you leave
Yeah.
them.
Yeah, and a lot
Which
of
is
domestic
unfortunate, yeah.
violence shelters, they don't share their location because of that.
Right.
So
Which is great.
Cool.
what's going on? But Maria's in good hands.
I know, we're gonna take care of you, Maria.
Yeah.
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 We're gonna support you and you won't be so alone.
Yeah. Awesome.
All right.
Well,
cool.
thank you so much.
Thanks
Thank
for
you,
listening.
everyone.
watching.
Thank you for watching.
Bye.
Bye.